Hello, and welcome to this talk between Sturg and me, Henrik from Fragments of a Nordic Mind. And tonight we are going to talk about something that is, I think, quite unfamiliar to a lot of you, and something that you might be very, what's it called? You want to have it. And you might want to have it, but let's see what our conversation brings. We are going to talk about the Danish welfare state system, and it sounds very big and difficult, and I assure you it is, because it's a complicated affair. The Danish welfare system starts out in 1890s because of the industrialization, and people moved from the country where their families still remained at the farms, and they moved into the towns and had their lives there. And all of a sudden, there was this lack of people to take care of the old people back where they came from. And it was kind of, okay, let's make it a cause for the state to take care of the elderly people in somehow. And first it was called a support for elderly. I don't remember the name exactly from the legislation, but it was so that the state would go in and pay for an elderly person's stay in a poor people's house, because they were all over the country, and it wasn't big luxury. No. It's much too early for that. But they were taken care of. They got food, and someone was there when they died, and like that. On it went, but was breaked up somehow by World War I and World War II. But we had social democratic governments in and between, and they worked. It was their main course to create these equal. What's it called? Living conditions for everyone in Denmark. Then after World War II, there came Wirtschaftswunder in Germany, and somehow it colored off here in Denmark. So we also got a lift up in the economy, and it all took a lot of speed against the thought of the state is the one to provide a proper care for children, for elderly, for education, for streets, for health care. And it ended up in 1956 with the Folkepension. It was where the state came and said, okay, when you are 67, we will, instead of you having no income because you cannot work anymore, we will pay a pension to the elderly citizens, so they can live a proper life and hopefully stay on their own in their own home and not be forced to move to the poor man's house. They were also taken away at the same time, and later on in 1964 I was born, and I do remember as a child how we went with mom and dad to the Social Security office, and mom and dad had to pay their share for health care for themselves and for us children. In 1968, I remember we all got a little brown envelope in the mail, and it contained our very new CPR number. And CPR is the Central Persons Registration. And it was one of the first in the whole world to get up in like that in Denmark. So every Danish person got a CPR number. And that should show to be the key to all these new ways of getting the support from state. In 1970, 2 years after the CPR numbers, the government decided there shall be no more private sickness insurance. So they closed down all these offices where you should go and pay your social security for healthcare, because they said now it is time that we have all persons registered here in Denmark, so we can go in and see where do the person work, and we can tell the employer to take a certain amount of the income as tax. But this whole percentage of the wages shall be used for social services, for the welfare state. It was for school, health, education, and everything. And all the way since then, no Dane has had to pay for health insurance. It is already paid for. It means I can go to my doctor and I just get an appointment and I go to my doctor and he will examine me and put out some medication that I need to get in the pharmacy. I have to pay for my medicine in the pharmacy. But if you are a person who has a lot of diseases and you need a medicine for over a certain amount of money, the state will go and say, okay, now it's time we take over and we pay your medicine. So, yes, we have to pay for something, medicine. We also have to pay for dentist. But just right now, our government is going to put out a bill that says that once a year, every Dane has a free examination of his teeth.
Wow.
That's
nice.
Mm-hmm. Every time I visit the hospital for an examination or things like that, it's free. In Norway, they have almost the same system, but they have the regulation that when you go to the hospital to get an examination, you have to pay a fee. So they have a little payment in own payment in the health system, which we do not have in Denmark. Yeah. So I started in school in 1970 and it was free. We even got some of the books and some of them were just for borrowing for the year of school, and some of them were forever. And it's the same way nowadays. The pupils will get a computer if they do not have one, and it's a very remarkable system. And yes, it do cost us something, but in fact, with the kildeskat, as the tax from your wages, taken away directly by the employer, you pay typically 42% tax, and there are some deductions first for driving to and from your work, and for work clothes, and for the sum of money you pay to more what is it called, when unemployment insurance. You can deduct that from the wages before you have to start paying tax, and then you have to pay these 42% of your wages. So yes, if you earn 10,000, it's not Danish money because we earn, most of us, somewhat more. And yes, you have 4,000 will go to the state for health insurance and for school and for health care, for elderly care, for pensions. That is gone, but you still have 6,000 for yourself. If you are then someone who earns, let's say, 60,000 a month, the tax system is made like that if you come to a certain level, after that you start paying more tax. So the person who earns a very huge, large amount of money will pay more tax than the little lady who just cleans at the school and earns a very little wages. She'll pay her share in the same rhythm as everyone else, but that's not so much money. But if she gets ill, she'll get exactly the same service as everyone else in the hospital, at the doctors. Her son will go to school, her son will go to university and have the free education, every possibility. So, yes, hello, Smudge. It was my intro. It was quite a long one.
Oh no, that's okay. I had a few times that I wanted to come in and let you know that that all sounds amazing because here on the side of the pond that I'm on, in the USA and in well, the United States of America, it's quite different how welfare is treated here in terms of caring for its citizens. So the type that you're talking about, and I was listening to everything, and I was looking at the like technical terms for all that, and that's called something called like a universal welfare system. And the type that we have here in the US is called like a selective welfare system. So what selective welfare system is it's means tested. And what that means is that you can only qualify for certain welfare programs if you are poor, disabled, elderly, whatever the case is, whatever that is. But there's still a bureaucracy around it. You don't just automatically get it. You have to apply for it. And I think that's the huge burden and gap for a lot of Americans at this point is that doing the paperwork to just get that basic decency when you need it is what bars a lot of people from even trying. I know that when I was applying for Social Security disability benefits a few years back, um, they kept denying my case, even though I'm clearly in chronic pain and I'm disabled. And I kept appealing and reapplying, and I just kept getting a no. You're too young. You're too this. You're too whatever. And I'm like, well, this isn't fair. I'm disabled. I can't work. What am I going to do? So hearing you talk about the Danish system in such a way, it's like everyone is cared for. And it's like, regardless of how much you make, who you are, like you're going to make or you're going to get that care you need. And that's something that I think a lot of Americans that as we see this Danish system, we're just like, wow, like they
Yeah.
actually care about their citizens and they want their citizens to be well cared for, even the rich. Like that's what I say for me as a progressive in America, I've been a long time supporter of single payer systems, especially one like the Danish system where you're paying a progressive tax, which in the US, if you ask an American, the typical American, would you pay more taxes to get more services? We are more distrustful of our government, and we're more weary, and we can't, like most of us say, we can't afford that because the cost of living out here is so high. And if we were
I
to be
don't.
taxed more, we wouldn't trust the government to do with our money what we would need them to do, like as in the example of like the Danish welfare model. And at the end of the day, I think that's why we're not. I don't feel optimistic that we'll ever get that, because it would also take a societal shift. And the thing is, I was looking up this research here. Um, I saw a recent survey by Pew Research that suggests that 88% of Danes support the Danish model, and they have a high trust in their government and high trust in the system. So that's why it works, because the Danes trust their government to do with the money what they need to do with it, and that they trust, and it's just more of a collective mindset as opposed to individual mindset.
Yes. Um, it has the last years have been somewhat discussed here in Denmark, whether the welfare state is going to survive because it's a public service and it needs people to work for it. And in the late years, it has been a struggle to find, let's just say, nurses, enough for all the places where nurses are used in Denmark. It's in hospitals, it's in clinics, it's in the home care, and I myself work in the home care as a nurse, and yes, we have difficulties to get new nurses, um, and the number of people wanting to get into nursing is going down, but it's kind of also because of years of long struggle against low wages for nurses, and the last period where it was discussed between employers and employees and unions. It was very much stressed that nurses are discriminated by being women. And that's one of the big hurdles in Denmark, where we struggle now to get an equal payment for men and women for the same work.
That
And
that's a big struggle in the U.S. as well.
and of course, this much discussion, somehow the young people also heard that, and many said, "No, we're not going into nursing because we're not going to get paid probably in a huge time in the future. So now we'll find something else to do." And the government has done a lot of efforts to go abroad and find nurses to come to Denmark to work. One of our ministers was in India, and a lot of very good schooled Indian women were willingly going to Denmark to start being a nurse. But I'm a bit afraid of very few people in Denmark speak Indian. So they have to learn to speak Danish. And although the government puts them through Danish courses, it's a very different and very difficult language for Indian people. So it hasn't been that big a success.
Yeah,
So
I
the
do.
lack of workers can be something to obstruct the welfare system in Denmark.
Well, I was going to say too. So when I was looking into some of the shortcomings of the welfare system, one of those was right now that there is, like you're saying, especially in nursing, there is a shortage of labor in the
Mm.
system right now. And despite the efforts of the retraining programs and of the sorry, I was about to say repatriation. I mean, integration programs where they bring the immigrants in from other countries to work in highly skilled jobs. But then there's the language barrier, which makes it more difficult to communicate with the normal Dane, like with sorry, I said normal Dane, typical Dane.
Yeah.
And it's becoming increasingly difficult to do that, especially like you said, the Danish language is hard to learn. Um, I mean, I even had trouble with it when I was learning it um, a while back. You remember about
Yes,
7 months ago? Yeah, yeah. My pronunciation is still pretty bad. My Norwegian helped a little bit. I think it's starting to help me understand all the Scandinavian or the Nordic languages better.
yeah.
I don't want to say Scandinavian because I'm only talking about Norway, Sweden, and Denmark. Yeah.
My dear, that's Scandinavia.
Yeah, yeah. Because Finland and
Finland
Ireland are
and
part of that's well, no, that's part of the Nordic countries. No,
yeah, for Nordic
yeah, yeah,
country, we'll talk about Denmark, Norway, Sweden, Finland, and Iceland.
yeah,
But when we talk about Scandinavia, it's just Denmark, Sweden, Norway.
yeah. That's what I mean. That was I had it reversed.
Yeah,
Um, but yeah, yeah, in Scandinavia. Well, so
yeah,
my point was here. I had a point. Uh, it's basically they're having trouble right now because of those things, and then also it doesn't help recently with the. I don't know how long ago she said this, but your PM Meta Fredrickson had made that controversial stance against the model of being the welfare model being threatened by immigration, like you were mentioning, from non-Western countries who she sees as more net recipients than net contributors. Although,
yeah.
I mean, that's highly contested. I mean, that doesn't really sound like actual hard evidence. I mean, although it might be, I don't know. I mean, I'm not saying that she's trying to provoke any like race thing here, but it feels like she's saying that she wants to halt immigration from some countries because of the fact that it's going to drain the welfare model. What do you think of her stance on that?
I think it's quite amazing that it comes from her, from a social democratic leader in a government. Her government
Hmm.
is a government over middle, so it has also some of the mild right parties in it. Um, but they are not influencing that. The social democratic attitude started before this government, and they have really turned strictly against many restrictions from the EU about immigration and a time long that she closed the Danish border against Germany because they had to be control every individual coming into Denmark, and if they hadn't got the proper paper, they were turned back to Germany without any further notice. And
Hmm.
it was uh, it was a terrible time. It took extra long time to go to Germany because of this control, especially when you got back and when you sit in your car on the highway and you just want to go home, and you have to
Hmm.
be controlled. Are you hiding someone under the seat of the car? That's not nice. And that was stated by the Social Democratic Party, very unfriendly, and yeah. But she I'm sorry to say, but yes, she might have some point in the statement about immigrating people costing too much for the welfare system because they just they don't want to give, and that
But that's more of that's more of a general statement than it is for an individual. Like, mhm.
and um, some years ago, and I think still there's this total crazy idea about um, all the Islamic people coming to Denmark, and they are going to take over Denmark, and it's a lot of rubbish. So many aren't here in
Mhm.
Denmark. That would never happen. And I have in my lifetime known a lot of people coming from Palestine and other Arabic countries, and they have been the most wonderful, grateful people to have gotten away from their countries because they're they couldn't live in peace there because of what felt was right to think about their government or whatever.
Do you feel that maybe the right wing politics on immigration globally, in terms of like some countries that have taken more of a hardline stance, such as the U.S., has affected some policy that rippled all the way back to the EU?
Yes, I'm afraid it has.
Mhm.
It has gotten more obvious to and to be. It's legal now to say no. We don't want any immigrants. We just care for ourselves, and that's not a good human attitude. No, and it comes
And
from
mhm.
US. I'm sorry. Yeah.
Yeah, and I've even noticed that, like, in terms of American immigration to the EU, like now the EU is tightening their previously more lax stance on having Americans immigrate to the EU, and it's becoming harder even for American immigrants who come over from the United States to the EU. It's harder for them to get in now. I mean, if I wanted to go, which I was already talking about, I've talked about this for years. I want to go to one of the either Scandinavia, one of the Nordic countries, Western Europe, somewhere in the EU, or in the Schengen zone at least.
Yeah.
And it's like now I can't even think about doing that. I'm pretty much stuck here in the United States, and things are only going to get worse.
Yes, it is very restricted, and you have to show up with papers for your education. And if you do not have an education or skills that are sought here in the EU, you'll have no chance.
Um, I sometimes wish that my superior intelligence would help me with that, but I fear that I never match that superior intelligence to the highly skilled labor training. So I unless I were to go now and do something later in life and in my current physical state, then I fear I have no chance. But my partner, however, is very skilled in a lot of different things, and he would likely be a candidate for somebody they'd like to have in the country. And I did see Murphy just came in and said hi to us, so I just want to acknowledge that really quick because he's the first one to comment. But no, I really feel like just seeing this, like we think like maybe it's better on the other side, and we're thinking there in some cases it's true, but in some cases you won't know until you're on the other side. And
Yeah,
in
that's
this
right.
case, I almost feel like just by the way you describe it and the way that you related your own personal experience to it, that you're actually objectively telling us things that sound like they're more empirically and objectively better than the welfare systems we have within the United States and even other countries in the EU.
Yeah, we are one of the first to have this system in the whole world, and I can only say it works, and we survive, and in a good way, because after this system came along, and nobody will stand with a bill for a hospitalization. Um, there we have just gotten more wealthy.
Hmm.
Everybody has gotten more wealthy. And it is said here in Denmark, yes, we do have people living on the street, but that's their choice, because they could go, every one of them, to the kommune, the town hall in any city, and
Like a
say,
municipality, yeah. Hmm.
yeah, municipality. I have a problem. I have no place to live. My whole life is cracked down, and I really need some support, and they would get it. So
Hmm.
it's their choice that they are living on the street.
Yeah, and the thing is, in the US, when you see that,
Mm.
it's a failure of the system because our safety nets are so tiny and so flimsy
Yeah,
that, and even like with job security, like, so I know that when I was researching the Danish model, um the cool thing that I liked seeing there was that even though you can be fired easily at your job, you are eligible for up to 2 years of unemployment, and you get retraining through the state,
yeah,
and then you can go into another job. But in the meantime, while you're looking for that other job and you're trying to get your training set, you don't have to worry about going hungry or broke or like going on the street. Your housing is taken care of. Your basic needs are taken care of, and you can get by just fine until you find a new job. But
of
in the
course.
US, if you lose your job, one paycheck, you could be
Mm.
homeless, and then the government won't even care. They might even want to exterminate you at that point. I don't want to say that because it sounds so dystopian, but from some of the things that the current administration, the Trump administration, has been saying to homeless people, he wants to clear their tents out. He wants to take away their homes, and he wants to take their lives. Basically, he wants to put them all in mental health facilities, in camps and stuff. It's so wild. It's insane. Like the rhetoric he's talking right now against homeless people is almost as if he thinks homeless people are the problem and not the system. And I think that's by design, and not because he's stupid. I don't believe this administration is stupid. I believe they are evil, and I will
Mm.
stick to that.
So no, it is about homeless people. I know in Finland they have a very harsh system. If anyone is found living on the street, they are obliged to go to the municipality and get somewhere to live. Or the municipality will come and fetch them and say, "Hello, here is your flat. You have to live there."
That sounds like it's not humane, but I mean, I would love that. So,
Yeah,
I'm out on the street. I don't have a job and I don't have anything. And the government's like, here, we have to take you and put you in a new house. Oh,
yeah.
well, what do I have to pay for this? Nothing. Just
Nothing.
a percentage of your income if you were able to afford it. But for now, we just give you the house so that you have somewhere to live. You are so mean. Oh my gosh, why are you making me live in a house? No.
Yes, exactly. Uh, now we haven't really talked about people getting sick. Yeah, you mentioned it shortly. People getting sick and not being able to work anymore. And of course, the Danish worker is protected by some laws about how long you are allowed to be sick before you are just kicked out of a company. And um, it is. After that, free up to the employer to say, okay, I'll I'll give the person some extra months before I fire him. And when that happens, the social system will come and say, okay, we'll support you and you get your sick money, and but we will need you to come in um, uh, 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 speak with us every week or every 14 days, and
Just to check in, yeah.
check in. How is it? Everything going? And if it shows up that the person cannot work in the job he was earlier, there will be made a, a, a row of different examinations and tests with the person, and you will have a practicum at another company or in another working area, and you try to find out where can this person work if he can work. If it shows up that he cannot work at all or just a very few hours a week, he will get an early retirement pension in Denmark. And I know this quite good because my husband had the same. He was knocked down by a car in 2007. And in 2009, his examinations were closed, and they said, okay, he can work 2 hours, 3 days a week with um, a, a resting day between each of these. So that would say he could work Monday, Wednesday, and Friday, and just 2 hours every day. And you don't find an employer who will give a chance for that. So he was sent on an early retirement pension. And late, he got sick and needed to have a wheelchair, and I don't know how many, a big nursing bed here at home. And that was all arranged by the hospital. He didn't have to form in a lot of papers. It was all regulated from the hospital. So it was all there as he was sent home. So he didn't have to wait for it. And also after he got sick, he needed much more personal care, and that was also arranged. And the day he came home, the home care people started coming and taking care of him. So yes, and it didn't cost no. In fact, because I stayed home some days, and he asked me to do the things for him, I was paid from the municipality for those services to him.
That's amazing. That's unheard of in the U.S. I mean, that just wouldn't happen. If somebody had been affected medically the same way your husband had, your late husband, that would have been financial ruin. And that's the big thing in America. Like when we think about what happens to us with one catastrophic emergency, like our life could just be upturned and we would just be done. Like if you go disabled, you lose one job, whatever, and well, there are safety nets in place for people who are disabled and are medically assessed as so and are accepted for benefits, but the benefits here are nothing you can live off of. It's a little ridiculous what they give people on Social Security, disability, and on like these other disability benefits. $900. Yeah, my partner, he's disabled. He can't work. He gets $900 a month. That's 900 US dollars. Like, what are you going to do with 900 US dollars? You can't. The average rent in America right now, I think, is like $1,200 to $1,400 for a 1 bedroom. Like, you'd have to live with somebody, and it's ridiculous.
I'll just check what a normal elderly person's pension will be in US dollars. Just a moment. I'll just have to
Yeah.
find that
Go ahead.
later.
Do
And
that. And I was gonna mention while you were doing that Denmark has actually, because Denmark does have an aging population right now and one of the highest average ages in the world in terms of the population. Um, but the fact is, right now, um, the current government has proposed and has considered raising the retirement age, which currently stands at 67. Which, if that were to happen, I mean, a lot of countries are doing this now, so it's kind of like a domino effect. Like the U.S. has considered doing this too. But
we are too.
yeah, so what is the proposed age? 70 then?
My generation from 1964 is first able to leave with 68 years, and
Hmm.
then go 10 years later with birth, and let's say 1976, they will have to work until 69, and then a little later you get to 70, and I think the highest is 71.
Oh, that's even higher than the U.S.
Yes.
Um, yeah, well, I mean,
But
I guess
people
that's the
people
counter
are
to. Mhm.
most people are fit here.
Well, yeah, that's true. But I mean, still, to make somebody work until what would be considered past an age that would be considered viable for work, that's interesting.
Well,
Although I know that with Japan's example, because Japan is aging very rapidly now, and they have a larger segment of the population who is aging, and they're facing a lot of questions right now with their society in terms of, because their population is shrinking
hmm.
gradually, but it's shrinking at a rate that's alarming. And I think maybe Denmark sees that and is thinking, well, I mean, for our social welfare system to survive, we are going to have to do some things to tighten the wallet and to tighten. Yeah,
I
I think that's really where it comes down to.
I can go with 68, but I can also go on um, 1 year, 2 years more, and the government has instated a bonus for those persons who work 1 or 2 years after the official retirement date. So
Oh,
I will get a bonus from the state at about 50 or 60,000 kronas
what
a
does that
year,
come out to in U.S. dollars?
about 10,000.
That's nice.
Yeah.
Is that a one-time bonus or is that an annual bonus?
No, it's a one-time bonus. Yeah.
Oh,
So
so
if
that's
you,
just right when you get it. Right when you get it, you get that bonus.
yeah, so when you stop working and you had this extra year, okay, here are 60,000 kronas. So,
Yes. Hmm.
yeah.
You could buy a lot of
Normal,
you could buy a lot of Carlsberg with that.
sorry.
I said you could buy a lot of Carlsberg with
Yeah.
that.
The normal, right now, the normal elderly person will get it's kind of the lowest possible sum of money that everyone gets, also inclusive the one who earned the huge amount of money. He will also get the same amount from the Folkepension when he turns the 67 or whatever age we are now speaking about. But right now, that amount is 6,800 Danish kroner, and that would be $1,540.
Nice. Okay. And that's the same across the board.
That's for every Dane who is crossing the retirement age. And if you then were someone with a very low wages before retirement, and you haven't got a fortune in the bank and no personal pension fund, you can get some extra things built upon your ground floor payment. And well, I know people having to pay the rent is quite expensive in flats around Denmark. And I know someone, he had to pay 6,500 kroner for his flat. But because he was too low in income and only had his folkepension, he was granted so that he had only to pay 1,200 kroner rent.
So they reduced it by like 85% or something like
Rest
that.
was taken over by the municipality.
Mm-hmm. So wait, so then what, in that case, then are you saying that the state stepped in and helped, or
Yeah.
okay?
The state steps in and takes over, and it's 6,800. You're not getting rich. You can manage, especially if you get that help from with your rent. It will be fine. Likewise, when you are on a disability pension, you can you won't get rich, but you can survive and you can live decently. Yes, lots of them have personal pension funds, myself included, and in fact, the day I am going to stop working, I will have almost the same money as I have now as I'm working.
So you'll be set into your retirement age.
Yeah.
That'll be nice. And but let's just say, God willing, you're good for another. Well, you would want to work up until you said you might take the bonus, so you would probably work till you're like 70, maybe.
Yeah.
Yeah. So you would work a couple of extra years because you're still very fit and active and you're not that old. So yeah, a little less than a decade to go, and then you'll be making the same amount that you make now
I'm
working.
60 now. It's just 9 years.
Yeah, I know. That's
Yeah.
amazing. Yeah.
And I have no physical problems. Not that, of course, when I get out of bed in the morning, there will some place be shoulder or knee or back saying good morning. I heard.
Normal aging stuff.
That's normal aging, and after a little stretching, it's gone, and I'm fine, and I don't really have any problems. So why shouldn't I? Why shouldn't I think about staying and getting that bonus when they are giving it away?
It's a good point. That's a very good point.
Yeah.
I would say that if I were offered something similarly, if I was still in the workforce, but which I'm not, which is unfortunate, but that's another story. I would take the bonus as well if I were willing and able.
Yes, of course.
I don't want to be the person though that I've seen in the Walmart here in America where she's like 85 years old and barely able to move, but she has to work because she didn't earn enough to gain a pension to live in her retirement years. And so they used to have this thing called a greeter. I don't know if you know what the greeter is. It's the person at the door that says hi to everyone
Yeah.
and welcomes them. but like also has to do little tasks in the front just to like ensure. Sometimes they had to check the receipts when people would leave to make sure they weren't stealing anything. But
Mhm.
these greeters, right? Uh, and Walmart decided that they didn't need them anymore, so a lot of that workforce just went away. So I mean, these old people that were already struggling, not making enough money, those positions went away for them in a lot of places. So I mean, it's really sad. And to think that there are so many people I've thought of, like when I thought about this, it's like so many elderly people that should be better cared for that don't have that safety net, don't have that guarantee. And as somebody who's disabled at this point, I mean, it's scary to think of what's going to happen to me down the line if I can't find a way to try to get myself to be healthier again and find out what I need to do that. And I know the doctors aren't going to be able to cure everything and they're not going to be able to keep me on medicine forever. I need to figure that out, and I wish I was in a country that cared about it more than they do.
And
It's like I'm
and you know,
flapping in the wind at this point.
now we are talking about aging. I'll also have to say that in Denmark, when you are elderly and you are getting physically so weak that you cannot live in your own home anymore and need to go to a nursing home, um, you'll you'll go to a nursing home. You'll pay the rent for your flat in that nursing home, and all the nursing hours and the nursing needs and what they all have to do with you, or physiotherapist or whatever, that's free. So the person, yes, the person has to pay for his rent and for his food like every other citizen, but all the extra, the care and whatever they need to do with you, that's free.
Hmm.
Going to cost you your life. Otherwise, then, well, it is the last station for the most people to go to the nursing home. But yeah, but it's free.
I think one thing that we haven't really talked about yet, and this is kind of interesting that I found out when I was comparing the two systems, is that in the United States, because the insurance that you have through healthcare is usually sponsored through your employer. It's not a universal thing where you just have it from the time that you're little, whatever. Um, and the thing is some people will hold on to their jobs in America because of the fact that they have that insurance, even if it's a job they don't like or that they're not well suited for. They'll grind it out. They will keep working there, and their mental health will suffer for that too. And there's not any support for the mental health. But in Denmark, it's like you have all the social support systems. So like if there's a job you don't like and it isn't a good fit, like yeah, the employer can decide or you can decide to leave and then find another job, retrain, have a little bit of the social welfare, like the social safety net, and then go into the next job. It won't financially ruin you. But if you leave your job in America, there's a chance you won't find another one for a long time and you could become homeless. Again, we're going back to that homeless thing, but yeah,
Yeah.
you could, it's such a vicious cycle. But when a country has a strong safety net, a strong support system that incentivizes people to find the fit that works for them and to work in a job that fulfills them, I
Hmm.
think at the end of the day, that's a society we should all want and strive for. I think the mindset in the US is that we have to take the job just because it's a job and we have no other choice and you have to work every day and just all this and that and basically just suck it up. That's kind of like the mentality here. It's like suck it up. You're if you can't do this, you shouldn't even live. I don't know. I mean, that's how I feel about it, but I don't think that's necessarily how far they would go, but it feels like it.
If you're tired of your job and you quit your job and you stand without any income in Denmark, and you are fined 1 month where they do not pay you from social welfare. 1 month. So if you have had this, if you have been planning this a little and you have been saving a little money away for this month, no problem.
How
It can
many
be.
times do you think the average Dane would change their career? Like, is it often, or do they
Yes,
usually know what they want to get into?
it's in fact often, and I don't know the percentage of people who have taken some kind of graduation from a university uh, will change their education later, but it's
Mhm.
rather often, in fact. Yes.
Yeah, I'm looking it up right now. I see here that the average Dane will have about 12 to 15 jobs over the course of their career.
Hmm.
So because they have a high rate of job mobility, and basically, I'm trying to see here. It's because of the flex security model. You know, the fit for the employer or the fit for the employee,
Yeah.
and then it goes to the fact that well well I mean, I think it also speaks to the organization of the flat structure that you have there. Like, there isn't many levels up to management in
Yeah.
the system. As in the US, it's very competitive, and there is a very top down uh structure to corporation to management.
If you start on an education, you can get some money from state to support you in your daily life in your studying period. And
Hmm.
if you stay at course and you get the education done in time, everything is fine. You can borrow extra money from state for that time, and you will have to pay it back. You can. Lots of young people will go and take a job, and in that way keep afloat in the studying time. But the education is free. After that, if you have money or you are married to someone who has money, and you say, I don't really like my education, I'll take a new one. Again, the education is free. If it's university or some kind of practical job school or anything like that, the education is free. And but the government will come and say, oh, you can't get the support money for the studying period again. You had it once, and that will have to do. So yeah, I think it's quite fair to say, okay, you had the money once, you made an education, that you're not content with it, and you should have chosen something else from the start, maybe. That's
Hmm.
not state
So then at that
education,
point, does it? Hmm.
and
Sorry.
you'll have to pay it yourself. Yeah, and
So
that's
yeah,
fine.
that it falls on you at that point. Yeah, that's what I was going to say. So if they give you the money to start, and they're subsidizing your education, but then you decide to do something else after you already got the other education, then it would be
Yeah,
on you. Yeah,
yeah,
that's how I thought it would work.
yeah.
Um,
That, but a
I
lot
had
of
looked
people
at
do
some.
that.
Mhm.
Yeah,
I was looking at a official. It looks like an official Danish government website about some of the tax-funded benefits that your stuff actually goes to. I know you mentioned a few of them while you were talking earlier, but I
yeah.
want to read some of the other ones we didn't really cover, because this
No,
is actually pretty extensive. Um, so paid parental leave too. So
yeah,
the parents get I think up to a year combined
yeah.
with the child when they're growing up, and then the child benefits. You had mentioned that a little bit when you started.
And it has to be
Subsidized,
both and women.
yeah, subsidized daycare. I mean,
Yeah,
wow. Like,
yeah,
so the state will pay for the daycare, And I think that in my head, that I would say that that probably promotes more female participation in the workforce than in other
Yes,
in other countries that don't do that.
it does.
Which, like in the United States, a lot of women stay home and don't take full-time jobs, or they will, and then they have to pay for childcare. So there's
Yeah.
a trade-off there. Depends. But I would assume that the female participation in the labor workforce for Denmark would be higher than the US.
Yeah, it is. I'm sure it is.
And then let's see here. Student grants during their youth, further and higher education. We mentioned that. Um, Healthcare, general practitioner, hospital and specialty care. We mentioned that earlier too. Psychological care. This is an important one for youth,
Yeah.
age 18 to 24, to help them adapt to adult life, to go from being a child as well they were cared for. Which is funny because I know your Prime Minister Mette Frederiksen has mentioned in the past that she wants to be the Prime Minister for the children. So
Yeah.
she's focused her attention on the children. Does that public perception? I mean, does her label match her actual policy? Like,
No.
is that something? Oh, it mismatches. Okay, so it isn't. It's almost a joke then.
Yeah.
Okay. We mentioned the unemployment, disability, and sickness benefits, the housing allowance, early retirement with persons for disabilities. That was your husband. State retirement pension. We mentioned that. We already talked about that. Elderly care. I mean, obviously, that's awesome. Public libraries, which is a
Yeah.
huge public service. I mean, if you realize, even in America, like our public libraries are an institution. Those are places where people who become down on their luck, who become homeless, go to those public libraries. And many times that is their only source of internet access to gain some upward mobility, get another job, or find a house, or
Yeah.
something like find help.
Mm.
Subsidized public transportation, that's a big one for me because I'm a huge public transportation enthusiast, and I love countries that have great infrastructure for public transportation. Subsidized cultural activities and sports social clubs, that's so cool. Like there's like subsidized football clubs for the youth, which is really nice. I like that.
Yeah.
And then roads and highways without tolls, obviously, because you guys already pay into the system. So I mean, you would be paying for your roads through taxes. And then the police, the courts, and the national defense, obviously, that's all funded
Of
by the
course.
taxpayer. Which, for you guys, it's not seen as being robbed or having your money being taken from you. It's an investment in your future. It's an investment in society, which I think is really where the biggest difference in our models kind of can or diverge. It's like if you talk about taxes in the US, it's like, oh, well, this is a burden on me and this isn't going to anything useful. But in Denmark, it's like we all buy into it. The government, we believe in the government and the government will provide. And that's what it comes down to at the end of the day. How do you think how do you think I broke that down?
Yeah, I think that's quite interesting and quite the right way to see it. Um, I think it's I think every American people would be amazed what they would get for. You are so many Americans that you shouldn't. I think not need to have a tax percentage of 40. It could probably be very much less. You could try and take a total average American and say how much do you pay for health insurance um, and what other costs for
Secondary education.
secondary education and things like that, and try and say, okay, how much would that be if you set that in a tax percentage of your wages? And I think once I made this in Germany, for example, you have to pay your own health insurance, and I make the calculation together with a German, and he was at the end amazed that he was paying more every month than we paid with our percentage of income. Yeah. So I'm sure if you did the same calculation with an average American and what the costs are, it would probably show the same, that he's paying too much for his health insurance and so on, that it could in fact be cheaper and not life threatening if he gets sick or sacked.
Yeah.
Yeah.
So we're paying less, or we're paying less in taxes in America, but we're getting less from it too.
Yeah.
We're getting, and it costs more. It costs more per capita, like for things like healthcare and education and all these other things that are for profit in America. Um,
Easily.
and the thing is, if you look at the Danish system, like the healthcare, education, housing, all of that, the stuff that's subsidized by the state, it's actually less expensive, but there's more percentage of your taxes going into it, which means that despite the fact that you're investing, well, I mean, not despite the fact, because you're investing in it, everybody's buying into that system, and it becomes that, I think that's the way that it becomes a lower price, because everybody's in the system, even the rich people, and they pay a little bit more, but they're still in the system.
Yes, they are.
hmm If we were to treat it that way here, just tell all the rich people you'll get it too, but they already do, so they don't.
They don't care. It's the problem. Yes, the majority of people uh, should be able to understand these numbers and see that they are screwed in America. Sorry, that
I
they
mean, if
would
you're
be
not
much
wrong.
off in a type of system like the Danish. Yes,
Unless you make like $500,000 a year in America, you're screwed, or more.
and even the guy with 500,000, yes, he would pay some more than the little block on the street. He would pay some more taxes, but he would still have the big fellow feeling. I earned so much. Yeah, and he would just pay his bigger share of the cake.
hmm At the end of the day, I mean, you've really got to look at it. Like, these people should just see, I'm going to benefit from this system too. It's not just me paying for poor people, because honestly, that kind of mentality, that kind of mindset holds us back as a society, because you know what they say, like, a system can only be as strong as its weakest links, which in this case, I'm saying, like, the people who are the most vulnerable, like the poor, the elderly, the disabled,
Yeah.
just uh, all the vulnerable groups, even women in some cases, because like when you're pregnant, like you're in a vulnerable state, like you're carrying a life. Like,
Yeah.
we should be taking care of our people, just like, I mean, even if you don't have money, I think that's the whole point. Like, even if you don't have money, we should just be taken care of, period. It's not, healthcare should not be for a profit. Education shouldn't be for a profit. Housing shouldn't be for a profit.
Uh,
At the end of the day, it's just, these are all basic human needs and basic human rights. And anything other than that is a human rights violation. And I want to go as far as to say is that I think that the United States is committing human rights violations at this point, and they have been for years, decades. But Denmark seems to have it. Denmark seems to have have perfected, at least in theory and practice, or I
we
mean
have
in theory, the
and we
the
have
the right model to do.
and it works. And
Mm.
we are, in fact, a hell of a wealthy country. We do not have oil. We do not have, or at least very, very little, and we do not have metal in the ground. And we have some farmers doing some corn and cows and milk and cheese and pigs and sell them to China. And yeah,
Yeah.
uh,
Well, I don't want to completely I
a
don't
lot
want to
of
completely praise Denmark. Can I say something critical for a second that I read about earlier and it made me a little upset?
yes, of course,
So during the pandemic, right? Your Prime Minister Mette Frederiksen had called on the mink farmers to give up their minks because it was her belief that the minks were responsible for spreading the pandemic when there was no evidence to suggest that.
and
So she took all 15 million of the minks that the farmers had in Denmark and slaughtered
killed.
them all
Yeah,
and put them in open graves.
yeah, and it was a terrible thing to do, and I still, to this day, do not understand why that was necessary. I think it was an act of we don't like fur, so we have to get rid of it at any cost. And here's a good reason.
Yeah, I mean,
And,
I
uh,
understand, I guess, the morality behind it, but that is not the way to do it. Like,
no, 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 and it was it was a kind of out of thinking about the leading classes in Copenhagen that we do not like fur, we like vegan, and we cannot. Oh, fur is terrible. It's killing the animals, and they just had to be suffered away.
it's you're killing the animals, but then you kill them all. It's like,
Yeah,
what?
one more. Throw them away, not even using the fur.
It's like, how do you kill these, or how do you get rid of the problem of killing these animals for fur? Um, but then make sure that it doesn't, the problem doesn't happen again. Just kill all of them.
Kill all of them. Make it illegal. Yeah, that was terrible. And there has been those scandals with Mette Frederiksen, and here at the election day for the municipalities, 18th of November this year, her party went down.
Also, the Social Democrats did lose some seats.
Yes. And next year is going to be elections for parliament. And I don't think that anyone has the least hope that it's not going to do exactly the same at the general election again.
Do
And
you think do you think maybe the Venstre party will pick up any seats, or do you think it'll go right?
some of the elections will go to some of the link parties, but I think a lot of them will also go to the more right side of the things.
Oh,
Um, and we could see it in the elections here. The blue bloc, blue in Denmark is not social democratic. It's
that's the right.
that's the right, and red is left, and
The opposite of the U.S. Yeah.
as in the United States. And we could see that several of the blue parties they in
Oh
the
no.
last election, and
Like the
that
rise of the AFD in Germany and also the rise of the National Front in France.
yes,
Uh,
and
yeah.
Meloni in Italy. So
Oh, and the Reform Party in the UK too. I don't want to
yeah,
forget mentioning that.
yeah. So I fear that that could happen in Denmark, that some of those very right parties will get so much traction that they are going to have the power.
I think we mentioned it earlier. I think the Trump effect, the ripple effect of Trump's election in America has kind of rippled across the world.
And Brandon says, I think it goes back to our society's general lack of empathy.
I agree.
Brandon, I didn't see when you wrote it, so I don't know what you are connecting.
I know what he's talking about. He's mentioning the American mindset towards caring for our citizens.
Okay.
It goes back to a society's general lack of empathy, and I think that also ties into what I was saying earlier about individualism versus collectivism, and that's really where we're at. And what's funny is that another thing I wanted to bring up earlier, and I forgot to mention, is that the word socialism in any form is a very bad word in America because it roots back to the Cold War and McCarthy, one of the senators who was he was promoting the Red Scare, basically that communists and socialists were going to take over America and infiltrate us and basically turn us into the Soviet Union. And I think that mindset still carries on after generations. And people, when they hear the word socialism, even though technically what Denmark has is not inherently pure socialism, it's a social democracy, which is compatible with capitalism, which is what we want. But in America, we think we have, but we don't, because we have this system where only the richest people have all the money, which is oligarchy, and in the end, feudalism, which makes us all the slaves, and we have to work to survive, right?
Ours is capitalism in a gentle and fair way for everyone.
Exactly. There are elements of socialism. There are social elements in there, but they are social capital elements. They are still providing. There are rich people in Denmark.
Yeah.
We've said this. There are rich people in Denmark. The argument against it is that wealth will be capped and that nobody will be rich. And that's not the case. It's just that the rich pay more and they can still make more money because they still have people that they can depend on to do the labor, because those people who do the labor make money too.
Yeah.
And they're able to survive and live. So that it's actually a better system, because if you have enough people that are healthy and that are well cared for, you're going to have a better workforce.
Yeah.
So, I mean, this mindset that it's going to come from the top down instead of the bottom up, it doesn't make any sense.
Sturg, I think we have 1 hour and 17 minutes. I think it's time to.
I think we did a really nice. This was a really structured, very constructive conversation about it, and I think my elements of bringing it in from an American's perspective to help you contrast what you were talking about in terms of all the great things you have.
Yeah,
I think it was very, very. I think it'll help a lot of people understand what we're actually looking at when we see countries like Denmark and other countries that adopt that social welfare model. But Denmark's is uniquely special because it is the most functioning, I believe, in the world in terms of the social welfare model.
Yeah.
Even more so than even some of the Scandinavian countries, particularly Sweden.
Yeah, that's right.
Yeah.
So I'll say thank you for the invitation to this talk. And
I was honored. I am honored to do this with you, and I want to do another one with you soon. I hope we can schedule that at some point. I will connect with you after this, and we'll schedule something else and do a different topic, maybe something lighter. You know, this was very policy driven, very substantive. So I feel like we could do something more fun.
If you're not subscribing to any of our channels, people who are watching right now, then please feel free to find Fragments of a Nordic Mind and Sturg Writes It Down here at Substack, and do press that subscribe button.
Thank you all, and thank you, Henrik, again.
Thank you, Sturg. Take care.